also have a case where the education had a spine injury. However, for this patient, because of the severe levels of pain that she was actually experienced, right, she is currently on ultrasound guided therapy. That was very interesting. So this machine is the ultrasound machine. However, what it does, it will emit rays to the soft tissue. So here, you will put on the gel on the patient, and you will just basically set it to what degree of waves you want it to translate to the soft tissue, and you will just rub it in circular motions with a gel applied to the skin in small circular motions, and it will emit the rays to the soft tissue, and patients usually would improve this. However, note that this cannot be used on the spine itself.
So this morning we had a patient with a rotator cuff injury. So this is the apparatus that we set up so that she can increase her range of motion. Also, she had difficulties elevating her arm above the level of her head. Right, so she used the same apparatus to guide her in elevating her arm above her head. Also to add, she was doing some dumbbell flies so that she can strengthen that rotator cuff muscle.
Today, so we are here at the speech therapy department at the Linden Hospital complex with Miss Crystal. So Miss Crystal, today we have a few questions for you.
Okay, what are some of the common conditions you see here in speech therapy?
All right, in speech therapy, there's a lot of conditions, but the three main common ones we're seeing presently are children with speech and language delay. We also have children with autism, and we have, for the adults, we have the CBA patients who presents with speech problem,
Okay,
speech and swallowing problem.
thank you. So what are some of the treatment approaches that we use here in speech therapy?
All right, for the speech and language delay, it's basically play therapy. That's the approach we use. We use the play therapy to have stimulated children so that they can produce the speech that's already been delayed. Also, those that are unable to follow directions, unable to communicate effectively, we use the play approach to help them.
Okay, thank you. All right, and the last question, what are some of the pros and cons of speech therapy? What are some of your insights towards the service?
My insight towards the service is it's a good thing because here we get to see so many improvement after patients come, because some parents would come to us and say, oh, this child is not talking, he's not following his directions, he's unable to answer simple yes or no questions. You know, when we take them in and we start to stimulate them and we actually use our cues and our prompts and get these children to do exactly what their parents say they're not doing, that's a plus for us. So with the play therapy, it's awesome.
All right, thank you so much.
Here we are at the occupational therapy room at the Linden Hospital complex with Miss Marks.
Hi, Ms. Marks. What are some of the common conditions in occupational therapy?
Okay, so occupational therapy covers a wide scope. So we deal with musculoskeletal conditions, we deal with amputees, pediatric, we deal with psych. So in those areas, for example, we see children with autism, we see children with ADHD, we even work on the wards with burn patients. We see conditions like CVA, cerebrovascular accident. We see amputations, both upper extremity, lower extremity. We see upper extremity conditions as well, among other things.
Okay, thank you. What are some treatment approaches to occupational therapy?
Okay, so seeing as the main goal in occupational therapy is to help patients improve in their independence, our treatment will target that. So for example, for a patient that had an injury to their upper extremity and they're unable to do activities like cooking, cleaning, dressing, we design activities specifically to target this. Likewise with an amputation of the lower extremity, naturally speaking, the balance and strength and range will be affected, and these are required for activities. So we advise patients on proper body mechanics, on assistive devices that can be used and such.
Okay, thank you. And what are some of your insights towards the occupational therapy service here at the Linden Hospital complex?
As I'm new, practically a baby, I'd say that I've not gained much experience just yet, as my patient load isn't very high, but so far, so good. With the patients I've seen, I've managed to set appropriate goals for them, and we're working towards achieving those goals.
So today we are here with Miss Gasper, one of the physiotherapists attached to the Linden Hospital complex Rehabilitation Center.
Hello, Ms. Gasper. First question, what are some of the common conditions in physiotherapy?
Some of the common ones that I've seen so far being in Linden are patients with osteoarthritis. We have a lot of stroke patients recently, CVAs, and we have also a lot of tendonitis.
Okay, and what are some treatment approaches to the
Treatment approach would normally follow modalities. Either we use a hot bath, cold bath, or something that helps with the pain, and then we go straight into exercises.
Nice. And what are some of your insights towards physiotherapy service?
Well, physiotherapy works only if the patient is committed to doing the exercises at home as instructed when they come for therapy. So it works, but you have to be consistent with it.
Okay, thank you.
here we have a patient with us.
Hi, good morning.
Hi, morning.
Can you please tell us what kind of injury you had?
So I have this dislocated my kneecap, which is called patella. So it came out to the side.
Okay, thank you. And can you show us a bit of the exercises that you had to do here in rehab?
Sure.
Just tour.
This one.
Mm-hmm. Alright, thank you. Can you tell us a little bit about the referral process? Like, how did you end up in the rehab clinic?
Well, after I felt the scars after I was dislocated, and then it was scars for a month actually.
Mm-hmm.
And then I came to take it off. But my knee was still swell, and I couldn't walk like how I used to walk. I was limping and it was pain and so forth. So they referred me to therapy. I came and I started some exercise, and it's coming back good.
Alright, and what are some of your thoughts about the services that you received?
It's very good. As far as I thought it would be painful, but it's not. Actually, good and it's working.
Okay. Thank you.
Here at the Linden Hospital Complex Rehabilitation Services, the referral starts from the primary care physician. If who deems it necessary, would refer you to whichever type of rehabilitation service you need. Aside from the physician, we have our sports athletes who don't need a referral but can walk in and receive right away for whichever service they need. Also, children can be referred by the teacher or by their parents themselves. Using an example, we had an athlete who came in with tonsillitis. That athlete would have not visited the primary care physician, but he came in right away and he got whatever service he needed. Referrals can also occur from the rehabilitation center as well, such as the case of this patient who had an ACL injury and was not getting better even after 6 sessions. So that patient was referred from the rehabilitation center by the physiotherapist to the primary care physician to have an ultrasound. Following on the question of if the referral system is easy to navigate, from the administrative perspective, it's easy to navigate because it lessens the burden on them, and it also allows them to have better patient control. From the patient perspective, it needs a little more work since it needs to be more smooth from the time of being referred by the primary care physician to actually receiving the rehabilitation service.
A pleasant good day to you, Dr. Villery. This is the Linden Rehabilitations Group PowerPoint presentation on the models of disability. These are our team members, and here is our table of contents. So the first model is the medical model. So with the medical model disability, right, it basically views a disability as an impairment to a body system or to its functions. However, the goal of this model is to restore such functions to a normal state by focusing on the medicinal aspects. Thus, health professionals are viewed as experts and the differently abled persons are viewed as the problem. So within this model, in a nutshell, is that the disability that a person has must be corrected by some form of medical intervention. Now I'll hand you over to the next presenter.
Moving on to the next model, which is the social model. It says the social model of disability posits that disability is not solely a result of an individual's impairment, but rather a consequence of societal barriers and attitudes. In this model, disability arises from the interaction between the individual and their environment, which may hinder their full participation in society. For instance, having inaccessible buildings, lack of accommodations, or discriminatory policies can limit that person's opportunities and quality of life, irrespective of their impairment. So using an example, consider a person with a mobility impairment who uses a wheelchair. In a medical model, their focus might solely be on their physical condition. However, from a social model perspective, barriers such as having stairs without ramps, lack of accessible transportation, or societal prejudice against wheelchair users significantly impact their ability to engage in activities and access these resources, highlighting the role of environmental factors in shaping disability. Now moving on to the next model.
Good morning. So moving on to the Nagy model of disability, this is also known as the disablement model. It was developed by Nagy in the 1960s, and it provides a framework for understanding the progression from pathology or impairment to functional limitation and disability. So these are the 4 components of the model: active pathology or impairment, functional limitation, and disability. So pathology or impairment, this actually refers to the presence of a health condition or a disease that leads to a loss of abnormality at the tissue, organ, or body system level, while Functional limitation, this component encompasses a restriction or lack of ability to perform an action or activity in the manner within the range considered normal for a human being. Next, the disability. This refers to the inability to perform socially defined roles and tasks expected of an individual within a social and physical environment. Now moving on to the next.
All right, so we're looking at the ICF model. Now, the ICF model is the International Classification of Functioning Disability and Health model, and it views disability as a dynamic interaction between an individual's health condition and contextual factors. This includes environmental and also personal factors. It want to emphasize its function rather than focusing on a person's impact.
What ends up happening is that their appointment dates can be placed further out